So how does radiation cure cancer at the same time that it's also possible that it can cause cancer? Well, it all comes down to the biology. So I'm going to use this regular coaster as an example. If this was a cancer that was inside my body, what you would do is you would give it a big, huge, massive dose, thousands or tens of thousands of times larger than your annual natural background radiation dose. And you would do that by giving it one dose along this axis so that it was thin, one dose along this axis so that it was thick, and then at other different angles all around through the body, shooting the radiation at different angles, so that around the outside of the tumor, the dose is fairly small because you came in from multiple angles and you only maximize the dose right there on the tumor. What that means is that you can give a massive dose to the tumor, thousands or tens of thousands of times larger than your natural background annual dose, whereas the dose to the tissue around it is much lower, comparable to, say, 100 or 1,000 times larger than natural background. And the body can recover from that. So if you're only getting a dose that's, say, 100 times larger than your annual natural background, the body can fix that. It can come back and recover and become healthy tissue. And so the tumor therefore dies. It gets a lethal dose, but the rest of the tissue around it just gets, say, a tenderizing dose that it can recover from. Now, because you're able to cure cancer or kill the cancer with this, there is a small possibility of cancer coming up around the tumor where you were irradiated. But it's only a possibility. There is no guarantee. So it's an issue of, you can have surgery where you could die from the surgery and still not get all the cancer, or you could do radiation where all of the little tendrils of the cancer that might be taking place outside of where the tumor was, that does get a dose. That way the chemotherapy will take care of that, and the radiation will weaken it, but the body can then still recover on the healthy tissue that only got a large dose. So by having a small probability of getting cancer in the future, simply by curing it now, it makes a lot of difference as opposed to actually cutting somebody open. So you can do radiotherapy and chemotherapy and address most cancers quite effectively that way. So that's how we're able to cure cancer with radiation, and yet still have a small increase of some detrimental effect in the future, which is very, very small compared to the risk from cutting somebody open and doing surgery. So great question. Thanks for answering it. Hope you have a good day. Bye.